I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. As many of you know, April is Autism Awareness Month, and I have here with me today Dr. Arsha Vahabzadeh. He is a psychiatrist from Harvard Medical. He is a Singular University graduate, and he's also the Chief Medical Officer of BrainPower. Please welcome Dr. Vahabzadeh.
Thank you very much. Pleasure to speak to you today.
You as well. Could you tell us a little bit more about some of the hallmark features of autism?
Right. So our understanding of autism has changed over preceding decades since its original description by Kanner and subsequent additional description of Asperger's by Dr. Asperger. What we understand about autism at the moment is that the key impairment appears to be a problem with social communication. And that really means that people have a hard time understanding how to relate, understand, and interact with other people in terms of verbal, nonverbal communication, understanding some of the nuances around social interaction, things like sarcasm, for example, and being able to have a back and forth, like a reciprocal conversation. It's also been noted that joint attention is something that's affected. So the ability to show somebody, direct someone's attention to something that you're interested in. So we know that social communication, its many different subcomponents, appear to be a major area of difficulty or challenge in autism. Also, there are a range of repetitive and restricted interests that have been described. So some individuals with autism will really hunker down and focus on a specific area, and they will become extremely knowledgeable about it. So for some individuals, that could be the weather, for example. For some individuals, that is computer components or trains or cars. And they will really study that in a level of depth that is quite striking. Additionally, some individuals have repetitive behaviors. So they may do something called stimming, where they may have kind of repetitive motor movements, for example, like rocking, or take an interest in behaving in a certain way in a repetitive manner. So really the hallmarks break down into two big subgroups. One is social communication impairment, and the other one is a range of restricted and repetitive behaviors. And this varies greatly between individuals. The specific nuanced type of social communication impairment, whether they're verbal or nonverbal, and whether the restricted repetitive interests are prominent or more subtle.
Why do you think that the rates of autism have increased in recent years?
We know that they've increased, right? Because at the moment, I think that the national statistics are 1 in 59 or so children will be diagnosed with autism. And that went up recently by about 15%. We know that diagnostic criteria changed with DSM-5 in 2013. The changes in the diagnostic criteria essentially made autism somewhat of a broader condition that people will be more likely to recognize because of increasing awareness and potentially diagnose. Autism is also a gateway diagnosis to a lot of services and help for individuals. So we should also bear in mind that there is considerable interest in families who are struggling with a child with developmental disabilities to have an autism diagnosis, because simply our health systems seem to work in that manner that opens up really resources that would benefit anybody with a developmental disability. So I think predominantly it's related to how we diagnose, awareness, and our ability to kind of say, hey, we may diagnose to allow people to have access to services. I don't think, based on what we know, it's related to the actual biological rate of autism significantly going up. So I think it's more related to diagnosis and awareness.
That's so interesting. How do you think that technology or technological advances can improve mental health conditions in general? And then we'll talk about how some of these improvements can be used to treat patients with autism in a pretty powerful way.
Right. So, I mean, technology is all around us, right? So we're speaking now using laptops and a variety of devices. If we look at our homes, we're surrounded by devices that really attend to our voices and speech. So things like Alexa, for example, Google Home. If we look at our cars, there's increasing technology available in cars for self-driving and things like that. So technology is all around us. And when we start to think about mental health, we start to think about the fact that a large part of mental health is determined by how people behave and how people interact. And a lot of technologies allow us to, in a proxy way, understand and monitor that, and potentially do something about it. So when we think about technology, we should think about the things that we have in our pockets. So, for example, smartphones, because they're incredibly powerful computers that capture so much about us. So there are efforts like digital phenotyping, where people are attempting to use how we interact with, for example, a smartphone, capturing that data, whether it's us doing something actively or passively, like the GPS, when we're sending text messages, for example, how we interact on social media, how we just interact with a touchscreen, to try and determine if we, one, have a condition such as depression or bipolar disorder, and two, if we're experiencing an improvement or deterioration in that condition. So, for example, if we notice that somebody with depression has a smartphone and their GPS signal suggests that they're moving around less and interacting less in terms of the social environments around them, social venues, for example, that combined with several other strands of data might allow us to think this individual could be struggling for some reason, and it could be a deterioration in terms of their depressive symptoms. Aside from smartphones, there's many other things as well that are happening. For example, we have a large volume of medical records available on individuals of varying quality and completeness. But there's a trend towards trying to analyze large amounts of medical record data to try and identify people who may be at particular risk of certain events happening. So there's efforts, for example, to use that to look at which individuals may potentially be at higher risk of suicide or a negative behavioral event after discharge from a healthcare facility. And that obviously plays out in terms of lots of different types of data that we can, again, analyze to find nuances by using things like machine learning that a human clinician wouldn't be able to potentially postulate or assess, because we're taking so many strands of data, and you may find something that's very nuanced, involving many subtle small factors that a human wouldn't be able to get their head around, but a machine learning component could really kind of identify. So lots of things in our pockets, big data. There's a push towards using things like virtual reality and augmented reality, and an increasing amount of evidence to suggest that those tools may be able to have a role in therapeutic services, for example, as the technologies actually become more usable. So, there's an entire range of different things that are happening. I think the real challenge is, how do we really validate what we're seeing? Because we can collect absolutely heaps of data, and it's meaningless unless we are able to actually identify something that's clinically significant, and who is it clinically significant for. So if we use just depression, for example, hundreds of different symptom combinations that could be used to diagnose depression, and they could vary between individuals. It's a very heterogeneous disorder, like many psychiatric conditions. So it's almost like we should perhaps use the technology to help us to subtype and understand these behavioral manifestations in a different way. So maybe we can actually use technology to identify that what we currently define as autism in the DSM-5 may actually be many different subtypes, right? Like historically, we would have said like melancholia, atypical depression, but we may find very, very much more nuanced ways that technology could reveal different subtypes that may respond in different ways to our current interventions. There's a real vast array of things. Yeah. And pharma companies have been interested.
Yeah, I think that it's incredibly powerful, the direction this field is going. And I think what you touched on is very true in terms of how do we interpret these results. But the data that we're able to collect is staggering. I think that's incredible. So much more so than we could without the use of this technology. So,
absolutely. You look at your normal kind of medical visits to a clinic, and they are periodic, intermittent, and we rely on patient report to really tell us what's happened in those interval periods. And having a means of digitally capturing a lot of information about the patient rather than relying on a 1 or 2 word or 1 or 2 sentence answer regarding sleep or exercise or mood is much more powerful if we have that continuous kind of feedback of information.
So Then, how do you think that these technological advances can help in treating symptoms in patients with autism? I know that you have quite a bit of experience with this, and we'll get to talking about brain power in just a minute. But what are your thoughts on technological advances for the treatment of autism?
I think there's a lot of hope here, and in part, it depends on how you approach this question, because you can approach it based on how we as clinicians would approach it based on the diagnostic criteria. Like, okay, these individuals struggle with social communication. What are those subcomponents? And how do we tackle each one through a technological innovation? For example, how do we improve the ability of an individual to understand sarcasm or make better joint attention or have reciprocal interaction? Or the other flip side is how do we address restricted interests or repetitive behavior? Another completely different way to look at it is actually to just talk to the community. And that's something that we've done a lot at BrainPower. And it's to really see what are the needs of the community, aside from the symptoms that we clinically recognize. And the things that we have found are just different. So in the community, we find that if someone is a young adult with autism, the concern is when am I going to gain some degree of independence, or when am I going to be able to go to college, or when am I going to have a job? So we move from symptoms to actual life successes. And when we look at younger children, for example, again, the parents are wondering, how is my child going to do at school in terms of special education? Are they going to have friends? How are they going to develop through puberty? And how do we kind of address stress within the family? Because it can be very stressful trying to find the resources for somebody with autism. So the latter is really where we've focused on, is just directly assessing, like, what do families want? They want to address their stress. They want the child to be successful in school. They want the child or young adult to get prepped for college and have a greater ability to interact or be successful in the workplace. So in terms of that, there's a variety of efforts aside from us as well to build skills in people with autism. So it's to build competencies, for example, in the workplace. It's to build ability to kind of recognize emotions when they're younger, whether that's using robotics, for example, emotion AI type technology, virtual reality or augmented reality. And it's to try to get the children to improve the way that they interact with others. And I know that ABA is very popular, for example. So there's some efforts to try and figure out, how can we enhance the delivery of ABA using digital means? So there are a lot of different ways potentially that we can help people with autism. But for me, one of the important things is that we stand back and say, like, what kind of construct are we going to use when we develop technology? Are we going to go very much like symptom-based, according to the way that we understand it clinically? Or do we go a little bit broader and understand the needs of individuals and families? And a very specific example I can kind of give you is a lot of families are worried about the child wandering away, running away. And it's very common in autism. We know that about 50% of families experience this in their children with autism. And unfortunately, it's like wandering away as such is not a specific symptom.
Right.
It's not like a DSM-5 symptom. So if we're looking clinically, we wouldn't recognize that as a target symptom. But if you talk to families, they're like, well, how do we address that? Is there some digital tool that we can use to keep track of kids? And some companies are trying to put like GPS tools. Are there certain kind of behavioral interventions that we can do that allows kids to understand the danger around them? Because a lot of kids with autism, unfortunately, end up coming into contact with dubious people or drowning or having bad outcomes as a result of being separated from their loved ones. So it's just a kind of different way of trying to tackle the same kind of challenges.
Can you tell us more about Brain Power, what it
Mhm.
is, what you offer in terms of services? I know that it's a company all about using digital technology to improve mental health conditions like treating patients with autism. And could you share with us a little bit about your role as the chief medical officer there?
Sure, sure. So, as you mentioned, like BrainPower, we're a neurotechnology company founded in Boston. We are supported by congressional research and development grants, along with some other federal funds. We've actually been supported by several charities now who've really aligned themselves with our mission and have actually directly kind of funded several initiatives within the company. And we actually have a product that schools are actually buying. So, actually, schools that want to provide special educational resources for children on what's called a IEP, so children who have kind of developmental special education needs. And one of our principal products is called the Empowered Brain. And what that is, that's smart glasses. So if you think about Google Glass, for example, these are computerized glasses that you would wear on your head. They're very lightweight. They can capture audio and video. They can also display through a transparent screen display information directly to your eyes and also give you audio feedback through a bone conduction device. So they allow you to capture data and actually give you information, visual and audio. And computerized devices have a lot of sensors on board. That means they can understand where you're looking, how your head is moving, for example, to some degree, your body positioning. And we use that to coach social skills, social emotional skills in children, adolescents, and young adults with autism. And we do that using a variety of different apps that I think we're going to come on to, specific apps targeting specific things that families have told us have been very challenging for them. So I'm the Chief Medical Officer of BrainPower, but we actually, I don't want to blow my own horn because we actually have some very interesting people in the company across a wide range of different disciplines, from neuroscience to engineers. A quarter to a third of the company is actually autistic.
Right.
So we actually hire employees with autism, and I mean, some of them are really, really phenomenal. And having this neurodiverse component is very helpful to us when we're dealing with sensitive topics or thinking about some of these complex problems where some people will be approaching it from an engineering side, some people from a clinical side, and then some people have real lived-in experience with themselves and with also the autism community.
I think that's so incredibly powerful. I mean, in terms of the strength of what the company can do that way, in that sense, it's really inspiring. That just gives me goosebumps. Can you tell us a little bit more about the three major apps that you've developed at BrainPower and how that treats the more specific symptoms of autism, some of those hallmark features that we talked about? Do you think you can maybe just tell us a little bit about each one? Don't have to go into a lot of detail, but I know there's the face-to-face, the transition master, and the emotion charades.
Right, absolutely. So we're targeting these social and emotional skills in these children. So parents have told us, hey, you know what? I've noticed that it's hard to kind of get my child to pay attention to my face, to look at me in the eyes. I feel that's a real issue for me, and I feel the child doesn't learn. And we know from the science that it's important to pay attention to faces, make eye contact, mutual eye gaze. So one of our apps is called Face to Face. It helps you to look at faces and make eye contact. So the child would wear the glasses, and the glasses through the screen display will guide the child through using enticing kind of game-like digital overlays like emojis or dragons or points or levels to move their head towards their parent. And as they practice doing that, they get more points and they get more rewards. And as they get more experience, that digital overlay, that game-like interface dissipates. So essentially they're learning through this kind of digital bridge to make eye contact. Because we know a lot of these kids are very good at using tablets or laptops and things like that, but they're not so good in the social world. So this is almost like a bridge between the real social world and the technologies that they love and use every single day, because they're heads up, hands free, and they're interacting as they get some of that digital feedback, but they're actually in the real social world.
Right.
So face-to-face helps them make eye contact. Emotion charades, once they're looking, emotion charades actually, the technology allows the glasses to read a human face, identify a human emotion extremely accurately, and gives the child a range of options to say, hey, you know, what is the emotion that you're seeing in your parent? And the child with a very subtle head movement can choose between several emojis that they see through the display. For example, happy or sad. And they play a game with their parent where they identify the right emotions and they actually proceed to, if they're able to speak, they engage in a verbal conversation with their parents about what that emotion means. And then finally, we have Transition Master, and it almost says what it does because it's helping them to master transitions. And we know from parents, you know, they've said to us in many different ways that, you know, our child struggles from going from one room to another, from one activity to another activity. And we know that people with autism do actually have a lot of struggles changing up their routine, responding to change. And so Transition Master allows them to experience a new environment or new activity before they physically ever have to do it. And it does that by allowing them through the screen to see a new environment in 360 degrees, whether that's a picture or a video. So they could be in a new classroom or on a mountaintop, for example. And they can experience that in the comfort of their own home with a parent next to them. They feel any kind of distress or upset or anxiety, they don't have to continue looking at the display because they can actually see straight through the display into the real world if they want to. So it's not like a VR headset that they have to physically like hold their hand and move the headset out of the way. They could just look down or look to the side and they're back into the real world with their parent or teacher. So it's a way of allowing them to experience a new school activity or work environment and learn about that way before they have to be there. So it saves a lot of training time by, for example, employers. It saves time in terms of school because you're automating some of this kind of helpfulness in terms of getting them acclimatized to a new task.
And you've actually published some research on some of this data. Is that correct? I think specifically with the Empowered Brain Program and the face-to-face. Do you want to share a little bit more about those research findings with us?
Yeah, absolutely. So we have two ongoing IRB-approved research programs because obviously, like whenever you develop, there's a lot of technologies that are being developed for lots of different reasons in healthcare, mental health, in education. So one of the things that's important to us is trying to validate what we're doing, right? To show that does this actually work and is this of utility? And also what's important to us is this practical? Because if we develop something for a classroom and it can't actually be used by a teacher in a succinct manner, nobody's going to use it. And that's what the data suggests. So we have a range of different studies. I think we have like 9 papers or so published with several more in review, just ourselves. And we have external validation studies underway as well by independent academic organizations. And our studies have shown that basically the technology is safe. So we haven't noticed that anyone has had a major side effect in our research programs. We've noticed that people can use it. Surprisingly, to some people, children are able to keep the glasses on their head. So that was a concern. Like with all the sensitivities that many children with autism have, like will they even keep this thing on their head? So we had to almost like prove that point because people really wanted us to show it in a scientific manner that was happening because a lot of these kids don't wear glasses, for example. And then obviously it's like, well, it's Google Glass and they don't wear glasses, so how are they going to wear Google Glass? But the experience is different because the child's actually being kind of brought into this game-like interaction that they don't get with normal glasses. And, we've shown that we can use a technology in a lab to improve social communication. We've shown that teachers can actually use it in a school setting, in a real world, real time school setting without any additional resources to provide 10 minutes twice a day of this kind of social communication coaching to their students. So we've shown that it's like practical in that setting. And, we've had parents and teachers rate how the child is doing on validated scales. And we found that, there's been improvements in terms of behavior, how the child interacts. 75% of the time, caregivers are actually surprised at how well the child will interact with this type of smart glasses, with these type of apps. So, yeah, that's important to us to kind of put some credibility and validation behind what we're doing. And we have some much larger studies currently underway just to really kind of step it up to the gold standard.
That's excellent. What is the most rewarding part of what you do at BrainPower and just in treating patients in general with autism?
Yeah, I think there's a lot that's rewarding. I think for any clinician, and obviously you've got a lot of listeners who will be clinicians, when you see someone kind of give you positive feedback down the line. I had a patient the other day. I was just walking down Charles Street in Boston, it's right next to MGH, and I had someone approach me out of the blue on a weekend, and it was a mother of a patient I had previously seen, 2 patients actually, and just for her to say they're doing great now. And when I saw them, there was a lot of different challenges at that time, and and they're thriving and they're doing great, and a feeling that it helped. Because I think that mental health, there's a lot of stigma around it, and we all know that, and there's a lot of controversies and a lot of false science almost going around that criticizes a lot of the things that we do.
Yeah.
And I think just oftentimes the voices of our patients, the people who actually benefit from, whether it's therapy or whether it's from prescribing, those voices aren't heard. But it's like when you actually hear those voices in person, it's like, no, like this really helped. Thank you. That's very powerful. And the same thing with BrainPower. When you develop something and you're always self-critical of whatever you develop yourself, right? You're always like, hey, is this good? Like, I'm not happy with it. Can we do it better? But then someone uses it and they're like, no, this is exactly what we need. This is literally what we've been looking for. It kind of sometimes takes you aback a little bit to see what the actual demand and need is for assistive tools to help with some of these areas where we just don't have the resources in therapeutic services and the educational system and beyond. Especially recently, because of some of those interactions, that's been a very rewarding area for me.
That's excellent. Well, thank you so much for joining us. And thank you for tuning in to this episode of the NEI podcast. It's been a pleasure, Dr. Vahapsada. Thank you.
Thank you so much.
This podcast was brought to you by NEI Learn. Access all of NEI's CME activities from your mobile device. NEI Learn is available for download on iTunes or Android.